Okay, so I'm Brooke Baxter, and my disease is Legionnaire's disease, which is also known as legionellosis, legion fever, or legionella pneumonia. All of these are interchangeable. It's not the same as Pontiac fever, which is a different disease caused by the same agent. It's generally mentioned together in sources, so I included some information of it in the PowerPoint, but it is a different disease. Despite what the name implies, it has only a loose connection with soldiers and has nothing to do with combat stress reaction or PTSD. Legionella. Legionnaire's disease is a lung infection caused by any of the bacteria of Legionella genus, although the vast majority are caused by Legionella pneumophila. Legionella pneumophila does not cause Pontiac fever, although I believe most of Legionella bacteria can cause Pontiac fever. It is pathogenic gram-negative bacteria. It's an obligate aerobe, generally waterborne, and filamentous bacillus, and is unencapsulated. The picture to the left is of Legionella culture. Not sure if that's Legionella pneumophila. That information was not included. Transmission. Legionnaire's disease is slightly unusual compared to the diseases we studied in class. Its reservoir is mainly non-living, specifically warm, stagnant freshwater. It cannot be transmitted from human to human or from animals, although some sources do claim there has been one case of human-to-human transmission. That has not actually been confirmed. The most common method of transmission is inhalation of contaminated aerosol particles or liquid droplets. This is why the majority of cases are caused by contaminated cooling towers, hot tubs, showers, faucets, water features, hot water tanks and heaters, large plumbing systems, and basically artificial water systems. This leads directly to another factor that makes Legionnaire's disease somewhat strange, which is while it is endemic worldwide, most cases are found in industrialized nations due to the necessary conditions for transmission, being generally rare in nature and mostly brought about by artificial water systems. So this disease is actually fairly rare in developing countries and is more common in more industrialized countries that have better water systems. This is a chart showing just all the ways Legionella can spread within a building: cooling tower, shower, hot tub, water decorations, etc. And the right is a picture of what cooling towers actually look like on rooftops. I'm focusing on cooling towers specifically because they spread Legionnaire's disease the most, generally responsible for most cases of Legionnaire's disease. They're used as a method of central cooling in large buildings, especially hospitals, which is why Legionnaire's disease is often transmitted in healthcare settings and often during the summer, where you're going to use cooling towers more. Cooling towers work by transferring heat through water pipes throughout the building to the cooling tower on the roof, where the hot water is essentially evaporated and recirculated throughout the building. The tower offers a perfect environment for Legionella and then expectedly spreads the pathogen throughout the building and the surrounding area. The Cooling Technology Institute claims that up to 40% to 60% of cooling towers tested positive for the presence of Legionella. There are many measures in place to prevent this. The WHO especially is on a campaign for cleaner cooling towers, but they are still generally the main cause of Legionnaire's disease. The symptoms: it's an infection of the lungs, it's a form of pneumonia. Symptoms are generally pneumonic. Mild to severe cough, shortness of breath, high fever, muscle aches, headaches, hemoptysis, diarrhea, nausea, and confusion, malaise. Symptoms generally begin 2 to 10 days after exposure. Death occurs through respiratory failure, shock, multi-organ failure. Immune response generally begins developing antibodies within 2 weeks. Note about Pontiac fever is generally non-pneumonic and generally flu-like. It is self-restrictive and does not require treatment. It is considerably less dangerous than Legionnaire's disease. To the left is a chart of general symptoms that I've already mentioned, and to the right is an X-ray of Legionnaire's disease. You can see the infection in the lungs. The diagnosis and treatment. Legionnaire's disease is thought to be generally underdiagnosed due to common medical practices. Doctors will diagnose pneumonia and begin treatment on that, but generally do not go further. Diagnosis for Legionnaire's disease specifically is often reserved when other forms of pneumonia have been ruled out or the patient is at especially high risk for it. It is often done through lab testing of urine or lung phlegm. Treatment consists of antibiotics, and most sources have said that it often requires hospitalization. Treatment is usually complete after a few weeks, up to 3 weeks to several months. Untreated Legionnaire's disease often results in life-threatening complications, including respiratory failure, septic shock, kidney failure, and eventual death. Sources vary on the disease mortality rate, but it is generally the same as most pneumonia, between 5 to 15%. That percentage climbs the more at risk you are for disease, the older you are. Patients over 50, older patients generally have an over 50% mortality rate. Prevention, those are risks. There is no vaccine for Legionnaire's disease. The most effective method of prevention is clean water supply. The vast majority of outbreaks are caused by contaminated cooling towers. So regular maintenance and use of biocides in these is going to prevent most Legionnaire's disease, and the same goes for other artificial water systems. So clean your hot tubs. Those most at risk for Legionnaire's disease are the elderly, immunocompromised, smokers, organ transplant patients, or those with chronic lung diseases, because it is a form of pneumonia. The majority of cases are male. I have no idea why. I don't think cooling towers usually discriminate gender, so I don't know what that is, and are usually over 50 years old. The emergence and incidence, the disease was first identified after an outbreak in Philadelphia in 1976. Those who contracted the disease had been attendees to a convention held by the American Legion, a U.S. Veterans Service organization from which the disease gets its name. In this outbreak, there were 221 cases and 34 deaths. The Legionella genus and Legionella pneumophila was isolated in a lab the following year. Incidence, Legionella is endemic worldwide, and most outbreaks of Legionnaire's disease are sporadic and concentrated in industrialized nations during the warm months. Cases of Legionnaire's disease have been actually steadily increasing, though that is mostly due to improved awareness, diagnosis, and surveillance. It might also be used to increased use of cooling towers and artificial water systems. I don't know that. We don't really have numbers on that right now. Despite being most common in industrialized countries, there's a particular lack of research on Legionnaire's disease because it's relatively short history and generally underdiagnosed. So the disease is actually relatively obscure, which is a little frustrating. This is the CDC's chart of the U.S. national incidence of Legionnaire's disease. The years that my recording box is covering is 2009 through 2015. So it has been increasing. We don't quite know why. Outbreaks generally make up 4 to 11% of cases. The rest are sporadic. There have been no pandemics of Legionnaire's disease because it doesn't transmit from human to human. The CDC considers it an outbreak when there are 2 cases of Legionnaire's disease in the same population, so it is pretty rare. Detection of outbreaks is somewhat difficult due to the underdiagnosis of Legionnaire's disease. The largest outbreaks include the Philadelphia one, the cooling tower in 1976, 1985, Stratford, England, also caused by the cooling tower, this time on top of a hospital roof, 175 cases, 28 deaths. Netherlands, 1999, not actually caused by the cooling tower. This time the infection came from the whirlwind spas of a hotel. The rest of the outbreak, or the largest outbreaks, did come from cooling towers. 2001, Murcia, Spain, 800 cases, 6 deaths. That is historically the largest outbreak of Legionnaire's disease. Also came from cooling towers on top of a city hospital. 2014, Portugal, 311 cases, 5 confirmed fatalities. Again, from cooling towers, did not specify where the cooling towers were. 2005, somewhat recently, neighborhood of Bronx in New York City, 130 cases and 10 deaths. The cause of that outbreak is still actually being investigated. So it is the box covers, it just says New York Health Department investigates Legionnaires outbreak in South Bronx. It's somewhat still recent. And that's it. Thank you.